I'm Dr. Julie Steck, and I'm a psychologist here at Children's Resource Group. In the wake of recent suicides in central Indiana, we have received a wake-up call to recognize the mental health needs of adolescents. In Indiana, suicide is the third most common cause of death in children and adolescents from ages 10 to 14, and the second leading cause of death for those from age 15 to 34. Only accidents exceed the number of deaths in adolescents from age 15 to 18. This is a wake-up call for the need to recognize mental illness in adolescents, especially depression and mood disorders. From 2008 to 2012, approximately 8% of adolescents in Indiana reported significant symptoms of a major depressive disorder. Yet only 2 to 3% received any treatment for their mood disorder. The rate of illicit drug use among adolescents is about 9 to 10%, and the mean age of alcohol and drug use among those who report use is age 13 to 14. So who is at risk for suicide? Well, those who have had previous suicide attempts are at high risk. Those who have family history of suicide are at high risk. Those who have anxiety, depression, and other mental illness are at high risk. And those who abuse alcohol and drugs are at high use, as well as those who are socially isolated. What can we do? Well, no one system can do it alone. We need to mobilize families to be more involved with their children and to be aware of who their children are with and what they are doing. We have to recognize that the peer group is the primary support system for adolescents, so we need to be aware of who those peers are for our children and to be actively involved. Medical providers need to be aware of the symptoms of mental illness in adolescents and to refer for treatment when appropriate. Schools need to provide warm and nurturing environments with adults available to students without risk of judgment or punishment if adolescents seek assistance for themselves or their peers. And mental health providers need to help educate others about the mental health needs of children and adolescents and to provide the highest quality of care. At CRG, we are committed to focus on positive mental health in children and adolescents by focusing on the whole family and the resilience of youth, and by assisting schools and other systems to know how to support and recognize those who struggle. We are committed to outreach in the community and have speakers available to visit your organizations through our Speakers Bureau. We are committed to providing the highest quality of care within our practice and in collaborating with other providers and other systems. It takes a village, and we are here to partner with youth, their families, medical providers, and schools in supporting and protecting our greatest assets, children, adolescents, and young adults. Thank you.